Good morning. Okay, I just thought I'd touch on today as to why people decide to go through the surgery. Because remember, weight loss surgery is a tool, it's not a cure for obesity. And there's a lot that goes with that. For example, in the program I was part of, you need to go to an information meeting, and that tells you all about it. Why do people choose to do this? It's a lifestyle change. It's definitely not a solution, and you have to use it as a tool in order to be successful with it. Let's check out some different points to go with this. For example, are you aware that basically there's almost 9 million adults, just the adults in the US, that are severely obese? And it's not because they're lazy or want a shortcut or anything like that, because again, it's not a solution. It's because they need help losing the weight to be able to handle their hypertension, their asthma, their lower back pain, swelling in their legs, if they have fatty liver, to help take care of that, as well as continue on take care of artery disease, things like that, joint issues. Now you have to qualify for surgery. Like you have to be overweight. Your BMI has to be higher than 40. Mine personally was 44 when I first entered the program. Or it needs to be 35 to 39, but you have to have some of the severe health issues that go with it. You have to have tried to do it on your own, but only had short-term success. And you have to attend all weight loss appointments, and they are major sticklers for that one, because without the appointments you don't qualify. There's a psych evaluation that you have to do, which is just insane. There's some really interesting patient goals and expectations that the program I was part of put on you. For example, you have to make sure all of your reports get to the clinic. You have to attend all your appointments on scheduled. If you have no-shows or if you have a pattern of canceling and rescheduling, you're kicked out of the program. You have to stay at or below your start weight with your, and that is at the first appointment in the weight loss program. You do have to exercise regularly, and you have to bring a complete and accurate daily food journal to every appointment. I'm not going to lie, that sucks. I am very bad at food journaling, especially when it's handwritten. It's just this major downer, but it gives you the accountability of everything you put in your mouth and how you treat it and the decisions you make. You have to discontinue use of nicotine forever. For me, that's not a problem. And that means no smoking, no chew, no patch, no gum, no vaping. Everything is off. You have to discontinue the use of alcohol or minimize it, as in like majorly cut down. If you're a type of person who likes to go home and have a beer every night after work, well, forget about doing it every night. I think it's like 1 or 2 times a week, maybe. But do you really need the beer? Think about it. Your life and children and significant others, friends, versus beer. What's more important? And you have to also recognize and respect the rights of the other patients, visitors, and staff that you might come across. It's very important. As I said, it is a tool. It's not a cure. In addition to this, surgery won't work if you're not willing to go through behavior change, nutrition counseling, change your diet, and you have to exercise. You have to be willing to eat less, pay careful attention to dietary protein intake, take daily vitamins and minerals. And this is every day, and this is for the rest of your life. This is not a decision a lot of people take very lightly in any way, shape, or form. Some people have difficulty with depression after surgery, mental health issues, and substance abuse. You can no longer use your crutch of feeding your face, so they start drinking. or doing other things. In order for anyone to be successful after surgery, you have to go through the psychological screening, nutrition counseling, and it is throughout the program and after. Like, they do not just go ahead and put you in the program and let you go at that. Okay, they are with you from then on, as well as being able to meet with a physiologist. At least the program I was in, they completely supported me in everything. They celebrated the small accomplishments of going to a restaurant and putting half my food in the box to bring home, to me losing weight. It's really important to have a support network in place. I always give major kudos to mine, which consists of my mother-in-law, my best friends, neighbors, family, things like that, and especially my husband, because he's on this journey with me. So just to give you a heads up, when I started this program, my first day I was 313.2 pounds. Okay. Requirements on me was to stay at that weight or go below it. I had to do all these blood tests to see where I am, my vitamin D level, my calciums, my lipid panels, all of this stuff. Plus, I had to have a sleep study done to see if I actually suffered from sleep apnea and didn't know. I had to have a cardiac clearance, just reviewing my health heart, making sure it was strong. Some other people have to have echoes done. They have to have pulmonary clearances, chest x-rays, pulmonary function tests. You have to give up your nicotine. You actually have to have a test done to see what the nicotine level is in your bloodstream. So, like, I avoided everyone who could possibly secondhand smoke anything. Some people have to go through exercise evaluations. There's an evening support group. Some insurances say that you have to go to 2 of those meetings. Mine didn't, so I kind of lucked out, not having to drive an hour for an hour. You do need to have the notes from your primary care physician sent to them so that they can see where you've been through the past year. And sometimes you need to have specialist clearances done. Like, I needed one for neurology because of a car accident I was in where I suffered a concussion. So that pretty much is the getting ready and the beginning steps. Okay. In addition to, like, for the nutritionalist, again, I had 4 nutritionalist counseling sessions before surgery. And again, don't forget your food journal because they look at it. Then you have your psychological checklist that you go through. You have to do your psychological testing, and then you have an individual appointment going through that testing. If you see a therapist on your own before surgery and stuff, they need to have those notes submitted, and they'll review them with you and everything, because they want to make sure that you are stable and dedicated and help you and support you in the way they can. That being said, we also have a surgical weight loss support group. They meet every month to go through things and talk to you about everything. So that's pretty much getting into some of the basics of surgery. As far as that goes, I had 4 group appointments that I went to where it was a large group of us, probably about 15, I think, was the largest group I went to. And in that, we just kind of reviewed what we're eating, what we're doing to change, make the changes in our eating habits, what helps, what doesn't, what protein drinks taste good, and which ones suck. to be point blank. After surgery, you have an appointment 1 to 2 months after surgery, then 1 to 5 to 7 months, 10 to 12 months, and then they will see you yearly for the next 5 years after that. That's not too big of a deal. And if you need additional support, you can always go. They will welcome you. Some of the program policies I already went through is you have to complete all medical insurance checklist items. And these were some of the things I had told you about, the different tests and things that you have to do. You're not allowed to bring your children with you to the meetings because they want you to focus on you, not on your child. Some reasons people actually leave the program is it's just not a good time in their life to make these changes due to jobs, families, self-awareness, things like that. Now you can be kicked out of the program as well if you refuse to make the recommended changes. You'll receive an advisory letter first letting you know, hey, you're not agreeing to the terms. And if you have 3 no-shows, just like college, they kick you out. So, they go through and they verify your insurance. What will your insurance cover to help pay for this whole program and the surgery and everything? And they also have a checklist put together because every insurance company is pretty much different as far as how the breakdown goes. It's just important things like that. So, as I said, when I started the program, I was 313 pounds and not very happy. Today, I am down to 239 pounds after surgery, and I'm still continuing to lose them, the weight, developing stuff. My start date was July 9th of 2018, so my journey has begun. So thanks for checking in today, and in the next short video, we'll be going over the keys to losing and maintaining the weight with the program. Have a great one. Bye.